بسم الله الرحمن الرحيم والصلاة والسلام على خاتم المرسلين ونتبعه بإحسان إلى يوم الدين. طبعا يشرفني ان ابقى موجود في مؤتمر مستشفى جنة النهارده. On behalf of the co-chairman, it is my honor to be on the hot table today, presenting the first session with the co-chairman, Professor Ahmed Yusuf, Professor Hisham Sha'lan, Professor رواء الردادي رواء
الجنابي.
لا مكتوب مش مكتوب الجنابي.
لا الجنابي ايه؟
طب اوكي الجنابي. والدكتورة فاطمة العتيبي. It is my honor also to present our first speaker. It is Dr. Mamdouh Iskandar from Saudi Arabia. His presentation is in the title of Keys of Success in IVF.
السلام عليكم ورحمة الله وصبحكم الله بالخير جميعا وألف مبروك للمستشفى والله يجعله المستقبل كله بإذن الله. Good morning, Mr. Chairman, Madam Chairman. It's a great pleasure being in my second home country, and really it's been so long since I have presented in Cairo, so it's really a pleasure of my heart being among you, and it's a pleasure also that you accepted the presentation. And what I'm going to talk about today, actually I would consider it as an introduction to the other presenters for the rest of this session, because I'm going to talk about keys for success in IVF programs. So if you look at what we're going to talk about, we, all of us, maybe working in IVF centers, we have pregnancy rates, right? And all of us, we would like to have our pregnancy rate increased, but though we have a pregnancy rate in most of the centers somewhere from 45 to 50%. Maybe some or few IVF centers in the world, they claim that they have a pregnancy rate, for instance, of 80 or 85%. Maybe it is a true figure, but I would look at it, it is a bit exaggerated figure for a pregnancy rate in an IVF center. So the problem is, how could we increase our pregnancy rate? So the question here that we're going to be answering by the end of this presentation is, which of the following factors will lead to the best pregnancy rate in an IVF center? Is it the IVF doctor? Is it the embryologist? C, patient selection, or the paramedical, or it's all of the above? I bet by now for sure you know the answer, but let us hold to the answer till we finish the presentation. We do our best to try to increase our pregnancy rate and the success rate by using different agonists, by using different protocols, antagonists, and so forth. But the majority of our patients, in the reality, they were gonna reach to the stage where they reach to the stage of embryo transfer. But who will really get pregnant as a clinical pregnancy in such cases? There are two major factors will increase your pregnancy rate. Number one is the evidence-based medicine, and number two is the techniques that you are using to increase your pregnancy rate. So we always say it takes two to tango. As a matter of fact, in the field of reproductive endocrinology and infertility and assisted reproductive technology, we shouldn't be saying it takes two to tango, it's 3 or 4 to tango. And if these 3 or 4 factors, they do not tango together, that means there is something wrong. So let us look. I'm not going to go into the details because of the time limitation. So let us look into the different factors, especially if you are opening a new IVF center, right? Let us look into the patients themselves. Patients, number one, we get to have a good look into the cause of infertility. I mean, as starting an IVF center, we shouldn't be selecting patients who have who are poor responders or have Turner syndrome, for instance, that is a mosaic Turner syndrome, or patients who are above 40 years of age, because patient selection here, it becomes very important, or you get to select patients who have like previous failed trials, 5, 6, 7, 8 trials, failed trials, unless if you are going to do something different for those patients. So patient selection, it comes the first factor in opening a new IVF center, and then it comes to the ART physicians. It's good and well to have junior RE physicians in your unit or in your hospital, but it's very important to have senior IVF physicians in your hospital. At least 1 or 2 IVF physicians should be present in the unit at all the time, because if there is a troubleshooting with the junior guys, then they can always come back to you. And most of the centers, they will have fixed stimulation protocols, fixed drugs that they are using. I wouldn't advise an IVF center to have a fixed protocol, because what happens usually, you get to tailor the medications according to your patient's need. So these are the most important thing, and then it comes to the OPU and embryo transfer. Of course, some more expert people, maybe they're going to talk about this in details. And we look into the embryologist and the ART lab. I do consider my embryologists, they are my backbone, because without them I cannot do. So you need lots of experience from your embryologist. You need the, most important of all is the quality control, right? So you can get somebody on annual basis or biannual basis to come and inspect your center and inspect your lab and so forth, and so on and so forth. And we do not get to forget the paramedical guys who come and clean the lab for us and do all the other stuff. So all of these 4 points should be kept in mind. Why I'm saying the embryologists are our backbone, because honestly, without them, we cannot do, because it's for a very simple reason. They have the custody of the gametes and the embryos. Once in the moment of the egg is being aspirated and the sperms are being ejaculated, until the embryos are being expelled from the catheter, it's in the custody of the embryologists. So all points of contacts and handling have potential impact on the outcome. But we get to know one important point, that your embryologist, they cannot do magics for you. I.e., if you give them bad quality oocytes, do not expect that they are going to give you good quality embryos. So if you give them good quality, this is like a bad quality oocyte, and these are good quality oocytes. So if you give them this, maybe they're going to give you a grade 1 embryo. But if you give them a lousy oocyte, most likely they're going to give you a lousy embryo too. So the optimal technology and expertise in the field of REI, and especially in the lab, is quite important. Now, maybe we finish from this, and usually we say that once fertilization is being achieved, chances of pregnancy similar regardless of the semen quality. Now, if we move again to our patients, and we used to say this in the past, but now it's being proved from either from the American Society for Reproductive Medicine or from the Canadian Society, or maybe even from the ISHRI as well, that if you have a male factor, you have to go more into the depth of investigating the male, and you go into the sperm factor, the DNA, fragmentation, etc., etc. So it's not good enough to just do a semen analysis, especially if it is a bad semen analysis. You have to go for further investigations of the semen analysis. More will be talking about the fibroids, because you got to have the hostes, right? The hostes is your uterus, so it should be free from the fibroids, should be free from any adhesions, it should be free from polyps, etc., etc., and you got to look into the endometrial thickness as well. So these are all multifactorial things that will increase your pregnancy rate in any assisted reproductive technology. ET is one of the most critical stage. We all know this. We all say it is based on science, as well as it is based on an art. They say ET is an art, because if the embryos are being mishandled or misplaced or being dislodged back into the cervix, it doesn't mean nothing. And there are certain factors will increase your pregnancy rate when you're doing embryo transfer. Positive factor like cervical lavage and like catheter type, etc., etc. I'm not going to go into the details of it. And the negative type is the negative factors that will reduce your pregnancy rate, like if the blood on the catheter, if you have mucus on the catheter, etc. So overall, pregnancy rate and significant increase in trial transfer and soft embryo transfer catheter. Nowadays, there is a study going on at the University of Western Ontario in Canada, where I was trained, and they're using a hysteroscopy for embryo transfer. Honestly, are they going to continue this study or not, or are they going to continue this trial or not? I doubt it very much that this will increase their pregnancy rate, because remember, you're putting here lots of intensive light, and you're putting as well as CO2, right? Even if you decrease the light to 10% of what you usually do in hysteroscopy, even if you decrease your CO2, still you're getting inside the uterus some amount. So this is the latest. Maybe next year, if I'm here, I'll keep you updated on what's happening with this trial that is going on in Canada. So we go back by the end of this presentation to the first question that I asked, and I guess all of you maybe by now would know the answer, which is all of the above, right? So the take-home message from this presentation is ART is a teamwork, and every member has a high regarded role in the success and in increasing the pregnancy rate. Thank you very much.
Thank you, Dr. Mamdouh. I'll introduce him after the lecture. Usually we introduce the speaker before. Professor Mamdouh Iskander is faculty member in Abha University, King Khalid, and he has a lot of publication. He had his residency and FRCS from Canada. It's an honor to have him today, and we'll leave the discussion until the end, just before Salah, inshallah. Thank you.